Come with me for a full shift. I'm in my pink Jeep and we're off to buy a house. I've finally reached the level 200 so I can get the seaside house. Here we go. I want one close to the daycare because I have a little baby that I need to drop off. So I'm going to pick this one right up here. You get out of your car and you click the for sale sign and you choose your house. Look, it's so cute with the palm trees. We're going to go in and do a little tour really quick. It's beautiful. Dining room, fireplace, awesome kitchen with a fridge full of food, some popcorn to eat. This is my bedroom. It has a little stuff for kids, beautiful backyard. We're going to go into my bathroom really quick, garage. Let's see, laundry room. Oop, I'm going to vacuum for a second. Okay, kids' bedroom next. Yep. Enough to have a ton of kids. Ooh, I got in the crib for a second. Silly me. Backyard again. I've got my baby in my hand down the hall. This is their bathroom. Another guest bedroom if you're going to stay with me. And outside just to show the baby our brand new house. Okay, time for bed because we have a big day at the hospital tomorrow. Night-night, baby. All right, it's morning. We're going to feed the baby some applesauce, and we are out the door. Oh, I forgot to lock it. Now we're out the door, and I'm going to drop my baby off at daycare down the street, not the hospital one. This is something I wish NPC could do. I wish they had NPC players at the daycare to take care of the baby. That would be awesome. Roblox, take notes. I tried to drop her off in a place where she'd stay, so I dropped her right here. I wondered if she'd be in the same spot when I got back. We'll see. All right, now we're off to the hospital. We have a full day and a big shift. Today, I committed myself to just treating burn patients. So you'll see me treating an adult burn patient and a child. The day is busy, booked. I go to the lab for a little bit, but we are booked and busy here. Going to the hospital. Before you start your day, don't forget to go to behind the desk in this room and clock yourself in. Oops, didn't help this lady. Sorry. I'm busy. Okay, locker room. I got to sign in, check in my patients. Who do I want to see first? Burn patient. Perfect. I'm headed to the ER to go pick up the burn patient. Let's go, sir. How can we help you today? Please don't code. We don't have time for that. Here's your room. Have a seat. I'm going to treat him, get my vitals cart. A trick I always tell everyone is to get all the supplies you need before treating your patient. So like your vitals cart, put it on the bottom always so you always have it with you. So we're checking him in. We're doing his vitals. He ends up not coding and being totally fine. But this is how you treat him if you have never seen me treat a burn patient. So I'm just going to let it go. You get him some medication for his pain. Oh my gosh, I hate when people close the curtains on me. For whatever reason, I like my curtains open just so I can see what's going on in the room. And I remember where they're at, but I like to see them. I know he's going to need a saline wash and a bandage, so I grab both. So we're going to clean the wound. We're waiting for the burn ointment to come from the pharmacy, so I just hang out here for a second. It'll be here soon enough. Ooh, this hospital is busy. Okay, here we go. We're accepting it. We're grabbing it from the basket. We're going to go put it on and the bandage. Okay, he wants a soda. He's feeling better. Good news. Here we go. Pretty soon we're going to just discharge him, but we're going to let him rest first. Nothing in my chart. Oh, what does he need? Okay, we're disconnecting him. We'll get his discharge papers and we'll send him on his way. If you can see when I go back to his room, the clock, the time says like 2:40 or something, which means it's probably time for me to eat lunch soon. All right, bye, sir. Have a good day. Feel better. All right, we're going to go up to the second floor. Here we go. We're not treating kids. There's none there. We're going to take a break to eat some lunch. So I went to the cafeteria, got my tray of food. I'm eating. Got to stay fueled to treat these kiddos. Oh, I had to make a stop at the lab, do a quick blood sample. There we go. Check on the pharmacy, see if there's any orders that need to be filled. Nothing. Perfect. Head back to the pediatric area. Let's see if we have patients waiting. Oh, perfect. We do. Alrighty. Oh, there's a code blue. I go in. I ask if they need help. Do you need help? I can't type. Do you need help? You'll see no one ended up responding, so I left. I could have easily jumped in and gone all over it, but I'm trying to be respectful, so I just got out of their way, claimed our little boy outside, and started treating him. Rooms were full, so we did have to wait a second. I could have taken him upstairs, but I just waited here. Here we go, another burn victim. It's the same thing as upstairs. It's just a child. So he gets his gown, I get my vitals cart, we do the whole thing. Oh, we need to remove that. We don't need that anymore. Give him the train off of the side table. I think you're going to be okay, little guy. He doesn't end up coding, which is awesome. We don't need codes today. It's our first day dropping baby at daycare. All right, we are going to hook him up here. This is where you would code if you had a code for a burn patient, but he's good. We're going to give him IV meds. He's going to be feeling better soon. Again, with the curtains, I like to keep them open. Just my preference. I like to see what's going on. Just how I like to do things. What am I trying to grab? Oh, the saline wash and the bandage. The pharmacy is going to send down the burn ointment soon, so we're going to go pick that up from the tube system, which is in the supply closet here. We're just waiting a second. After you apply the burn ointment, you do the bandage. All right, here we go. You're going to accept it. You're going to grab it out of the basket, put it on, put the bandage on. What does he need? Okay, he is hungry. That's a good thing. Little ice pop for little man. We're going to let him rest for a little bit. Then pretty soon he is going to be discharged. And this doctor/mama gets to go home for the day because it is late. His clock says 1 o'clock. But if you go upstairs, you'll see it ends up being almost 7:30 at night. And I haven't picked up my baby. So we got to go. Discharging the little guy. Parent signs the papers. We file it away. We send him home. Bye. Feel better. Don't come back. All right. We're headed up or down. I always say up or down. We're headed down. I'm going the wrong way. I'm confused. It's been a long day, people. I'm going out the front to go get my car, to go get my baby, to go home, have dinner, put us to bed. My car is not there anymore, which is okay. Oop, looks like this truck is trying to start a fire. But I get my car again. We get in it. We go pick up baby. Let's go, baby. Let's see if baby's in the same spot or if she just automatically disappeared. Hey, don't run into me. Rude. Off to the daycare we go. Down the street. Okay, go get baby. Sometimes I wonder if they disappear, but look, she's still there. I picked her up. We're going to head home. Into the pink Jeep. My house is right here. Super quick and easy. Pulling in. At least I try to pull in the driveway. Kind of crazy. Could have edited this out, but driving is hard in this game, everybody. All right, let's go, baby. Let's have some dinner and get to bed. What's in the fridge? Ooh, sandwich. Let's sit down. Let's have a little sandwich. Off to bed and another day. Follow for more.